Very good afternoon and welcome to our podcast. My name is Turin Anja Erlen from Green Mind Health Consultancies. With me in the studio, as usual, Master of Psychology, Mr. Rami Al-Khalil. Our topic for today is anxiety, in general, anxiety disorders. So, Mr. Rami, please tell us something about anxiety in general.
Yes, everyone can feel anxious for sometimes, but people with anxiety is more than feeling just anxious for sometimes. It's feeling fear, feeling worry, intensive and excessive for long time.
Mm-hmm.
And it interferes with relations, with other relations, with the family relations, with teamwork. It's affect the daily routine. It's يعني lead you to think over the time in small points, and you can forget a lot of things because of anxiety.
And what about the treatment? Let's say, how many people do get a treatment? Because in Europe, for example, there are so many people suffering from anxiety, but just a few get at the end the treatment.
Yes. According to WHO statistics, 1 of 4 people get treated because of anxiety. يعني you can just a few can get treated from anxiety and can receive the psychotherapy.
And would you say that female are more, like women are more likely to suffer from anxiety than men?
Yes, if we can make a comparison between men and women, the women have the more likely to develop anxiety than men. It's يعني depend on the way of thinking for the woman. Also, this is statistics. Also, the men didn't say that I am anxious,
they
or
feel ashamed. Probably.
Yes, because they all the time feel ashamed because to say I am anxious, or I need mental health therapy or
exactly, because you expect from the man being very strong, and if they would say, oh no, I have an issue, I'm anxious, I'm sad, then
also this is still the social stigma.
It's a stigma.
For
exactly.
mental health.
It is.
The man is strong, and the man is should not go to psychotherapy, not take medication, not go to psychologist. This is this stigma in most of societies.
Yeah, so they hide their feelings. I think this is very common for men.
Yes, sure.
Tell us something about the symptoms.
The symptoms of anxiety is feeling terrible more of the time, and in making a decision. Also there is terrible in making a decision for physical, and there is physical symptoms such as increase the heart beats, also trembling and shaking and sweating, and heart palpitations, It's happened all the time for person with anxiety.
So, what about the relation when we look into depression and anxiety? So, what would you say?
Yes.
Do they develop often? I mean, people who suffer from anxiety, do they develop more often a depression?
Yes, there is a relation between depression and anxiety. Anxiety increase the risk of depression. Increase also anxiety increase the risk of the suicidal thoughts, the suicidal attempts. It increased the risk of.
So, what about the different kinds of anxiety disorders?
There is a lot of anxiety disorders types, such as general anxiety disorders, social anxiety, and panic disorders, and agoraphobia, and most of these type of anxiety need treatment. And they didn't go away by itself.
That's the keyword, treatment. So what kind of treatment would you suggest?
For treatment, it's the psychotherapy is the first line of treatment for anxiety. We can use CBT for cognitive behavioral therapy for treatment, and there is support techniques, for example, teaching management stress, deep breathing, relaxation, and there is a good approach for treatment is mindfulness approach, and doing meditation. It's effective way and approach to anxiety treatment.
Exactly. So you just mentioned mindfulness. This is also something which is very common in Europe, and I think also in America, because there is this author called John Kabat-Zinn, and he also wrote a book about mindfulness, and it's obviously very effective.
Yes.
To just exercise and do this mindfulness exercises, go through mindfulness behavior.
Also nowadays it's very common, also mindfulness very common, and in Arab country it's very common, and because it's effective, and it's you can take it as a daily routine and use these techniques everywhere inside your work and outside, and it's very effective.
Is there anything I could do, like, let's say, kind of a supporting treatment?
Yes. Before being or you before have anxious or suffer from symptoms of anxiety, it should have in your package a plan of self-care plan. It should include the avoiding alcohol or drugs. This is the first point. The second point is do exercises, sports, activities as social activities as regularly every day. The third point is you can go to participation. You can participate with the social events most of the time, and you can learn how to do the stress management techniques, how to do meditation, how to do relaxation, how to do deep breathing, all the time, because you will need these techniques every day. And if you used to do these techniques, يعني it will be most of the time far away of anxiety. طبعا there is in some.
So you can, with all these techniques you mentioned, you can actually overcome the anxiety.
Yes, sure.
Yes. Thank you. Thank you so much, Mr. Rami. Thank you for watching. Please don't hesitate to call us for more information. Have a lovely day. Take care. We're there for you. Bye.